After studying this module, you shall be able to learn about the microeconomics of health, know about the importance of health economics, know about the determinants of demand for health care and health, learn about the supply of health, learn about the related concepts of health care, learn about the price determination of health. Introduction. Microeconomics of health. Health economics is an applied field of study that allows for the systematic and rigorous examination of the problems faced in promoting health for all. By applying economic theories of consumer, producer and social choice, health economics aims to understand the behavior of individuals, healthcare providers, public and private organizations and governments in decision making. There are two main models for describing the demand for health care. The first one is a simple approach where we take health like other normal commodities that follow the law of demand. In this case, health is treated as consumption good as it makes people feel better. On the other hand, health is also taken as an investment good as it increases the number of healthy days to work and to learn more. In the second approach, we treat health as a stock variable within a human capital framework. As healthcare can have long-lasting effects, it is taken as an investment in health. This approach was pioneered by Grossman in 1972 in his model on health. He explained that health is a productive resource and we consume health care as it improves the stock of health. Cropper in 1977 extended Grossman's model to measure the differences in demand for preventive and curative care. These models value healthcare services in terms of their potential to improve productivities. Generally, the effects of health status, income and price on demand for medical care determine the demand for health care. Many healthcare services have zero or low monetary prices due to insurance. The standard model suggests that demand for healthcare should be infinite or very high, whereas there may be excess demand for insured services in developed countries. Underutilization of these services may be a problem in developing countries. Role and importance of health economics. Health economics is used to promote health. It studies health through hospitals and clinics, health promotion activities, and the providers of health care. Health economists apply the theories of production, efficiency, competition, and regulation for the most efficient or cost-effective and equitable course of action of private and public investors. It evaluates the impact of market failure and inequitable allocation of resources on the health of a community or population. Health economics can help the state about action with regards to regulation, national health policies and program, health insurance packages, etc. Health care is a merit good. Health care is taken as a merit good because consuming it provides benefit both to the individual consumer and to others. We can give the example of inoculation against contagious disease. It provides protection to the consumer and also to those who are protected from catching the disease from these inoculated people before inoculation. Distinction between demand for health care and demand for health. Health can be regarded as a fundamental commodity that is essential to people's well-being, leading to demand for improvements in it. Although health is affected by health care, it is also affected by many other things and it also affects other aspects of welfare, not just health care. Does law of demand apply to health care? Yes, it does, as it applies to other commodities. As the price of health care increases, you demand less of it. But if we health insurance, this price may be much lower than the actual cost of providing you with care. Under most health insurance contracts, the marginal private cost of care to a household is less than the marginal social cost of providing that care. The consumer's demand for health care is derived from his demand for health. The demand for health care is therefore called a derived demand. It is derived from the demand for health. Individuals as production of health and health production. Let us see the production of health care. Output is being produced using a production function that uses labor, capital and intermediate inputs. What is the production function of a health? Health production function describes the relationship of inputs of health and flows of outputs of health over a specified period of time. Here output is usual some measure of health status, and health inputs are healthcare, environment, education, lifestyle, genetic factors and income. Price determination. How then are prices determined? Many of the most important prices are determined by the interaction of a few big players, including the government, insurance companies and pharmaceutical companies. Hospital and doctors get paid by insurance companies, households and the government. The interaction amongst all of them, because of these programs, the government is a big player in the healthcare market. Government decisions determine the demand for healthcare services. Governments do not take prices as given. In some cases, the government sets the rates for certain procedure and healthcare providers respond. In other cases, the government is involved in negotiations with pharmaceutical companies. For example, insurance companies provide additional source of revenues to the hospital and a doctor. If in our normal approach we say that each individual will consume a commodity or service up to that point where marginal utility gained is equal to the price of the additional unit. But in healthcare, the case is different. The healthcare consumer often has very little idea of the marginal valuation of that particular treatment being received. The consumer is very often not paying the full price for that treatment because the cost is frequently covered, at least in part, by insurance. So the traditional approach to demand does not work very well for healthcare services. The supply side is also problematic. First of all, some healthcare suppliers have significant market power. A bigger problem is that some healthcare suppliers, such as hospitals, are either government controlled or not-for-profit institutions. The standard economic approach presumes that firms seek to make as much profit as possible, but government or not-for-profit hospitals may not have profit maximization as their goal. In addition, healthcare prices are not necessarily determined by supply and demand. Again, the government has a significant influence on prices. For example, the government in some countries set prices for pharmaceutical products. Even if they are not set by the government, prices may be determined by bargaining between, say, hospitals and drug companies rather than by supply and demand. Furthermore, if people need healthcare services, then their demand is likely to be very inelastic. That is, the quantity demanded does not respond much to price changes. Inelastic demand is not in and of itself a problem for competitive market. It just means that the equilibrium price could be very high. But if we couple inelastic demand with consumers who lack information and add in some market power by suppliers, then matters become more complicated. Perhaps you already have a sense of why we have a large group of consumers with very inelastic demand who are relatively uninformed. It is more than a little misleading to treat healthcare as something homogeneous that is bought and sold in a single market. The main point is that the simple framework of supply and demand is not sufficient for understanding healthcare. There are too many different markets, each with its own peculiarities and unusual features, and those features mean that there are several reasons why we might expect inefficiency. One, as if we have already noted, is the presence of market power. Another is various information problems we have mentioned. A third is that some aspects of healthcare have the characteristic of a public good. The demand for healthcare. Now let us look at a little deeper into the demand side of healthcare. Response to price. The law of demand is same for healthcare as for other markets. That is, as the price of healthcare increases, the consumer demands less of it. But it depends on health policy. Also, if you have health insurance, this price may be much lower than the actual cost of providing you with care. With the contracts of health insurance, the marginal private cost of care to a household is less than the marginal social cost of providing that care. In this case, the household has an incentive to purchase a lot of healthcare services as being subsidized by insurance companies. Like many essential products, the demand for healthcare is relatively inelastic. If you are sick and require care, you will purchase health care services at almost any price. Though the ability to buy health care is a function of income of the consumer, but the person in the need of medical care may drop spending on other commodities. Health as an investment. Everyone prefers being healthy to being sick. Its demand expresses preference for it by the consumer. Money spent on healthcare is consumption as well as an investment. One thing that makes healthcare different from most other goods and services, though, is that it is simultaneously an investment as also benefits us in the future. There are several different ways in which spending on healthcare represents an investment. Mortality. Mortality rate depends upon the choices related to healthcare taken by the individuals. Mortality rate measures how likely we are to die at different ages. In 2004, the mortality rate in the United States for people between the ages of 15 to 24 was about 80 out of 100,000 or 0.08%. In contrast, the mortality rate for those over the age of 85 was 13,823 out of 100,000 or 13.8%. In other words, the typical young person has about 1 in 10,000 chance of dying in a given year, whereas the typical old person has more than a 1 in 10 chance of dying. It is not surprising that the mortality rate increases with age. That is, that young people have a lower probability of dying than older people, taking infants as an exception. But these average mortality rates disguise a lot of variation, much of which is under our control. Health can contribute in many ways in bringing down the mortality rate. For example, obese people have a higher probability of dying than those who are not. Similarly, smokers have a higher probability of dying than non-smokers. Other things like non-nutritious or unhealthy diet, lack of exercise, and unprotected sex also affect mortality rates. Cigarette smoking is linked to lung cancer and thus to mortality. It means that all else being the same, smoking increases the probability of death. Refraining from smoking is a type of investment in your future. Our diet also affects our probability of becoming ill and of dying. Healthy eating and exercising has effect on our long-term health. Making these types of choices is an economic decision. Each of us makes different choices because we value the taste of particular foods differently and we value our overall health differently as well. Productivity. Being healthy also means that you can work efficiently and earn wages. Loss of work days may be due to poor health. This is a cost not only to the individual but also to the society as a whole. The economy's population is producing less output. If you are in poor health, then you risk losing wages for the days when you cannot come to work. There is a provision of lost wages, lost due to sickness, as many employers provide insurance for these lost wages. Disability insurance is also a part of the social security system in many countries like the United States. The supply of healthcare. Let us turn to the supply side of healthcare. Economists often talk of output being produced using a production function that uses labor, capital, and intermediate inputs. What is the production function of a hospital? The labor in hospital includes doctors, surgeons, orderlies, technicians, nurses, administrative staff, janitors, and many others. Intermediate inputs in a hospital include dressing for wounds and pharmaceutical products such as anesthetics used for operations. The hospital building and other capital goods such as equipments, beds and diagnostic tools and X-ray machines, etc. are part of the hospital's capital stock. Some other related concepts of healthcare. Healthcare and moral hazard. Moral hazard means the risk that a party to a transaction has not entered into the contract in good faith or has provided a misleading information. So moral hazard is a situation in which one party gets involved in a risky event knowing that it is protected against a risk and the other party will incur the cost. It arises when both parties have incomplete information about each other. For example, you have not insured your house from any future damages. It implies that a loss will be completely borne by you at the time of a mishappening like fire or burglary. Hence, you will show extra care and attentiveness. You will install high-tech burglar alarms and hire watchmen to avoid any unforeseen event. But if your house is insured for its full value, then if anything happens, you do not really lose anything. Therefore, you have less incentive to protect against any mishappening. In this case, the insurance firm bears the loss, and the problem of moral hazard arises or when the individuals know that they get free and effective health care, they may overeat or smoke or fall into drug abuse. The third party payment. To provide the funding of healthcare, private insurance has been promoted as an alternative to government funding. But taking advantage of the situation, the consumer may inflate claims. This may be a problem with third party payout. And in such cases, the insurance company may pass on the burden to the policyholder. Healthcare as a merit good. In many countries where health is taken as a merit good, simple price mechanism based on demand and supply cannot work. Taking healthcare as a merit good when no price is charged for healthcare, demand will expand to its maximum, leading to shortage. This means that health resources should be rationed rather than given free. Scarcity. Economics as a discipline exists because resources are scarce and the wants of human beings are unlimited. If we use resources to produce hospital, then fewer resources are available to produce other desirable goods such as public health clinics. So there should be a match between the production and consumption process so that the quantity supplied matches the quantity demanded. Choice and opportunity cost. As we have unlimited wants and limited resources, choices must be made. This might be about how we spend our income, how we earn our income, how we spend our time, etc. There are two basic reasons for making choices. First, our income is finite, and second, given all the goods we would like to consume, our income is insufficient to finance them all. We must make a choice about how best to spend our limited income. Best means which gives the individual most satisfaction or utility. The margin. Marginal refers to the additional unit or the next unit. It must be a health service deciding whether to expand an immunization program or a doctor choosing whether to work an extra day. When we make a decision, we focus on changes in cost and benefit. Decisions are generally made on the basis of margin. If marginal benefit is greater than marginal cost, we go ahead. If marginal benefit is less than marginal cost, we do not. One phenomena which is generally observed is that of marginal benefits of most goods tend to diminish as the consumption of these goods increases. Efficiency and equity. Efficiency is a general term used to describe the relationship between inputs and outputs, and efficiency can be valued respectively in terms of cost and benefit. It is concerned with maximizing benefits given the limited resources available and minimizing costs for a given level of benefit. In healthcare, benefits may be interpreted as health gains, although health services produce a range of benefits, including less tangible things like information and reassurance. Here is a short list summarizing them. Technical efficiency, where a given output is produced with the least input, it is also called optional efficiency. Economic efficiency, where a given output is produced at least cost, also known as productive efficiency. Allocative efficiency, where the pattern of output matches the pattern of demand. Pareto efficiency, the point at which no one can gain without someone else being made worse off. Every level of health system faces questions about efficiency. For example, there are several ways in which hospitals might seek to improve the efficiency of their operations, including length of stay could be reduced, staff productivity could be increased, equipment could be fully utilized and maintained regularly. Implementation of these measures might be difficult, although some measures will be harder to enforce than others. To encourage the efficient use of resources, hospitals should collect financial data and managers should be trained to carry out cost analysis. There is also a need for staff to be aware of the financial constraints of the hospital if implementation is to be effective. Equity is another important concern of economists as well as of health services. Equity is about the distribution of benefits as opposed to their maximization as an efficiency. Utility is subjective. It usually has something to do with fairness and justice. Equity is different to equality. Equity is about fairness, but this may or may not mean the equal sharing of a good or services. Equity and efficiency are often conflicting objectives. For instance, it may be efficient to fund health services concentrated in a small number of large centers, but more equitable in terms of access to services to fund a large number of dispersed smaller services. Supplier, induced demand. Those with better knowledge about health and healthcare interventions are in a position to influence demand, and this phenomena is called as supplier induced demand or SID. Here there is potential for exploitation on the part of the supplier. SID could result in greater or less use of an intervention than would have been the case if the patient had the necessary information to decide whether he or she required treatment with it rather than existing treatment for their condition. Externalities. In economics, externalities describe the situations when the action of a consumer or firm affect the well-being or production of another person or firm. Externalities may be positive or negative. For example, pollution by a pharmaceutical company making medicine, causing harm to people or wildlife through pollution is an example of negative externality. Similarly, the use of vaccination program is an example of positive externality associated with the healthcare provision. Externalities are important in economics because they may lead to inefficiency. Opportunity cost. Opportunity cost is defined as the benefit that would be derived from using a resource in its best alternative use. All costs in economics are valued in terms of opportunity costs. If a choice is made to use one medicine or medical service over the other, then there will be benefits foregone. So how do we prioritize programs? Here the aim is to minimize cost for a given level of benefit. Summary. We can summarize the above module as follows. Health is an investment. Money spent on healthcare is consumption as well as an investment. As healthcare can have long-lasting effects, it is taken as an investment in health. This approach was pioneered by Grossman in 1972 in his model on health. He explained that health is a productive resource and we consume healthcare as it improves their stock of health. Cropper in 1977 extended Grossman's model to measure the differences in demand for preventive and curative care. These models value healthcare services in terms of their potential to improve productivities. Health economists apply the theories of production, efficiency, competition and regulation for the most efficient or cost-effective and equitable course of action of private and public investors. As the price of healthcare increases, you demand less of it. But if we have health insurance, this price may be much lower than the actual cost of providing you with care. Under most health insurance contracts, the marginal private cost of care to a household is less than the marginal social cost of providing that care.